Today, Governor Newsom announced state efforts to increase his vaccine allocation to the state's most vulnerable areas. KSBY reporter Tiffany Haas spoke with local educators and advocates about what it means for the Central Coast.
California will be reserving 40% of the COVID-19 vaccine for the state's most vulnerable neighborhoods. On the Central Coast, that includes parts of Lompoc, Paso Robles, Isla Vista, and Santa Maria. This is the California Healthy Places Index. Communities that fall into the lowest 25% will be receiving the increased vaccine allocation.
The lowest quartile being the most impacted with the disease burden, most impacted in terms of health outcomes.
According to the California Department of Public Health, the doses will be spread out among 400 zip codes with about 8 million people eligible for shots.
The map is describing communities that have higher rates of chronic diseases and are disproportionately impacted by the COVID-19 pandemic, as well as other chronic diseases that increase their risk of complications and dying from COVID-19.
Local advocates break down what this means for the communities they represent.
We are very excited to starting reaching out to the indigenous farm workers, more specifically to Paso Robles and San Miguel, where it's a big representation of indigenous Mixteco farm worker communities.
Lopez says access to internet registration and emails to sign up for vaccinations can sometimes be a challenge for the workers he represents. Santa Barbara County Public Health addressed some of these issues at a farm worker vaccine clinic in Santa Maria Sunday.
As we just saw in the farm worker vaccine pilot in Santa Maria, ensuring all vulnerable communities have access to the vaccine also includes language and culture. So we look forward to continue working with the Santa Barbara Public Health Department to ensure these incoming vaccine doses are distributed as equitably as possible.
In San Luis Obispo, Tiffany Haas, KSBY News.
San Luis Obispo County Public Health also said in a statement that they are currently working on how to implement the governor's announcement and are continuing to work toward getting the vaccine to populations that are adversely impacted by COVID-19.